A dog illness is sweeping through the United States, leaving owners everywhere concerned. Dr. Morgan McDaniel of Montgomery Animal Hospital cautions about potential implications for Louisiana during the upcoming holiday season.
I don't think we are quite seeing the outbreak in our area that's being reported in other areas of the country, but obviously with the holidays coming up, lots of travel, lots of commingling of pets, we're anticipating seeing more cases as the season progresses.
Kennel cough, or canine respiratory coronavirus, was first described in a group of shelter dogs in the United Kingdom in 2003, according to the National Institutes of Health. But this new illness is different and more severe.
The dogs are just not responding as well. So our typical cases that people describe as kennel cough are 7 to 10 day duration cases. This seems to be much longer than that in some of these dogs that are being reported. Severity seems to be a little bit worse, especially in the geriatric patients or immunocompromised patients.
Louisiana has no confirmed cases of the newly coined atypical canine infectious respiratory disease complex. Even with 0 cases, McDaniel says owners need to be extra mindful about the illness.
I would avoid commingling pets if possible. Boarding obviously is going to be a big thing over the holidays, and I think just being really diligent about asking your boarding facility, wherever you choose to board your pet, do they make sure that all pets that are boarded there are fully vaccinated before they come into the facility?
The Louisiana State University Dean of Veterinary Medicine, Oliver Garden, says the infection is spread through droplets and is an infectious disease and contagious. And McDaniel says to watch for potential symptoms in your canine to make sure detection on potential infection is sooner rather than later.
Coughing, sneezing, difficulty breathing seems to be the top signs, clinical signs people are seeing in these pets. Ocular and nasal discharge, so any abnormal discharge from the eyes, from the nose, decreased appetite and lethargy. Those are things that should be checked out anyway, but especially with an outbreak like this on the horizon, just so that we can get ahead of it.
McDaniel urges canine owners to make sure their pets are up to date on vaccinations and do extra research on potential boarding options, vaccination guidelines to avoid exposure to the illness. Brandon Brown, ABC 31 News, that works for you.